Hi, I'm Dr. Blanche Grube, and today I'd like to talk to you about bleaching your teeth. Everybody's doing it. Everybody wants to have perfectly white teeth. When the truth is, it's not natural to have perfectly white teeth. And I mean white like this piece of paper white. It just isn't natural. And it removes some of the individuality of our looks. So I'm not a believer that everybody should have perfectly white teeth. Having said that, yes, there are some people who have serious problems that usually come from a history, meaning some people have had to take antibiotics because they were prescribed to them by a dermatologist for acne. And when people take antibiotics for a long period of time, they wind up with teeth that are stained. And those can affect how you feel about yourself and your appearances. So in those circumstances, something needs to be done to cover the teeth and make them look whiter. I'm still not a lover of bleaching the teeth. There isn't a single bleaching agent, not a one, that does not have peroxide. So, what's wrong with peroxide? Well, remember when you were a kid and you would scrape your knee and whoever was taking care of you would pour some peroxide on your knee? And it was a lot of fun. You got to see the blood on your knee bubble up and it would make bubbles all over the place. I enjoyed watching that. I liked hydrogen peroxide also because it didn't hurt. I would always scream to my mother, "No, not the iodine, not the iodine," because the iodine burned. So she would pour the hydrogen peroxide over my knee. Well, that same bubbling action, when you put peroxide on teeth, that same bubbling action takes place when the peroxide passes through the enamel, through the dentin, and lands into the pulp. The red blood cells that are in the pulp explode, no differently than they did on your knee when you were a kid. And those little red blood cells that explode create a lot of pressure inside the pulp of the teeth. That's why people who are having their teeth bleached and having them whitened wind up very often having sensitive teeth after a while. There's a lot of pressure inside those pulps, and there's a lot of pressure inside the teeth. It makes the teeth much more sensitive. There's a reason for that. So, unless you really have a situation where your teeth are really dark or they've been stained by something and you just can't get it removed, then you might want to consider bleaching the teeth, but then you would want to make sure that you have a bleaching system that is safe. There aren't too many out there on the market. Like I said, all of them have peroxide in them. You might want to consider doing veneers instead. That's where a piece or chip of composite is placed on the surface of the tooth, and it covers the tooth without killing the tooth. Very important. Of course, you've heard me discuss in other lectures that the moment you put something on a tooth, be it a sealant, be it a composite filling, be it a veneer, the moment you put something on the tooth, you're preventing the natural fluid flow from the inside of the tooth to the outside of the tooth. That's one of the things that keeps the tooth healthy. It not only is a natural way of being, but it also washes bacteria from inside the tooth to the outside of the tooth. So any place, if you put a veneer on a tooth, any place that you have a veneer, if you have a coating, or you have a sealant, you have a filling, that area is going to be much more difficult for the tooth to wash fluid from the inside to the outside. Now, having said that, you have to remember that composites are primarily plastics with glass and quartz added to them. And plastics are porous. Plastics do breathe. So you do get some fluid flow from the inside to the outside of the tooth. It's just not, it doesn't happen as readily as it would if you had no veneer there. I hope I'm not confusing you. I hope you understand that always the best thing to do is to leave a virgin tooth alone. A virgin tooth is that tooth that has never had a filling, a cavity, a crown, a root canal, nothing. It is a pure tooth. It is clean. It's never had dental treatment. That's a virgin tooth. If you happen to have any of those in your mouth, God bless you. You're really lucky. Leave it alone. Don't do anything to it if you can help it. Sometimes you can't help it, but if you can help it, leave it alone. So let's go back to what we're discussing. We're discussing bleaching of teeth. If you bleach your tooth, you are changing it. You are changing the chemical configuration inside the tooth. You're changing it forever. It will never be the same again. So seriously consider if you want to do that to your teeth before you run to the store and either buy one of these over-the-counter bleaching agents or you go to a dentist who does it professionally for you. Always reconsider the fact that you are changing what God has given you naturally. Thank you. This is Dr. Blanche Grube talking about bleaching.